In orthodontic perspective, right decision at right time proves advantageous and successful in orthodontic treatment. So missing a good growth spurt also proves costlier to the patients as well as the practitioners. There is a common practice among the general dentists that any orthodontic treatment should be done only after 12 years of age. It is really a myth, and most of the preventive and interceptive and growth modifying orthodontic procedures are carried out in all during the mixed dentition period. So that is why this quote. So don't miss the growth. So always be focused on what you want. Whenever you act without thinking, there will be a problem, and don't keep on thinking. You have to act at the right point of time. And there is a common perspective. Why should we practice orthodontics? Why? If you do good orthodontics right from the beginning of the life of the patient, okay, you have with efficient law control, there will be no caries, no trauma from occlusion, and hence no periodontal issues, and hence no tooth loss, and no need for prostheses, implants, etc. Do you agree with me? Yes, sir. Say that. So when you say orthodontics, whenever we say orthodontics, the thing which comes in our mind is fixed appliances. I just want to eliminate that bad image of that word. Why? Because the goal of orthodontics is always a priority, and all these appliances are mechanical devices. It just helps to fulfill the goals of orthodontics, and goals of orthodontics are all about the specific type of appliance, whatever we choose. Whether it is going to be aligner, whether it is going to be a fixer, whether it is going to be a functional removal. So most of the time we will be focusing on appliances rather than concept of orthodontics. In orthodontics, the goals of orthodontics rise above all the types of appliances, whatever we choose. So what are the goals again? There are three important goals of orthodontics. There is aesthetic harmony, functional efficiency, structural durability. I just want to have a small introduction of these three things. Aesthetic is nothing but it's not attached to beauty at all. It's not making the patient beautiful. It is all about proportions. We have to bring the face, jaw, everything to a good proportion. That is what we are aiming at. What we call as golden ratio, golden proportion, which already exists in nature. We want to mimic that. Okay, that is what aesthetic harmony is all about. And functional efficiency. We all know that chewing is the only function what the oral cavity makes. But apart from that, we have various functions like speech, swallowing, respiration, everything. So all these functions have to be efficiently done only if we have a good set of teeth. So functional efficiency, for that we need orthodontics. And the need for structural durability. So in long term, whenever you want to preserve all your teeth and supporting structures for very long time, you need to have the teeth in the right position. So that whatever masticatory forces which are developed from the muscles of mastication has to be dissipated and should be neutralized by the structures which are going to take up the forces, primarily the teeth and the supporting periodontal ligaments and the amygdala. So these are the main goals of orthodontics, and all the treatments revolve around these three goals. So this is the result of very good orthodontic treatment. It is evident here in this slide. A good change in profile, and you can see a baby confidence in the patient's smile. There is a good alignment, change in the upliftment of the face. So much of changes you could bring about from the patient's life also. So this is a small introduction about orthodontics, and Raghu asked me to give about orthodontics. This is what we are about to begin with other important questions from Raghu side.
Hello. Yes. If I am audible, am I audible? Yes. Actually, போன செஷன் வந்து ஓரல் பேப்பர் வந்து ரொம்ப இன்ட்ரெஸ்டிங்காக இருந்துச்சு, எல்லாருமே ஃபீட்பேக் கொடுத்துருக்காங்க. We thought we have another interacting session on another topic. The most common problem we have is with ortho. Actually, 22 years of clinical practice இருந்தது ஆர்த்தோ கேஸ் நான் பெருசாக நான் பண்ணுறதில்ல. I take help of my wife. அவங்க தான் எனக்கு ஆர்த்தோ பண்ணுறாங்க. ஆர்த்தோவில் நிறைய நமக்கு மிக்ஸ் இருக்குது, அதெல்லாம் நம்ம கிளாரிஃபை பண்ணுவோம் அப்படின்னு சொல்லிட்டு சாரே வில்லிங்காக வந்து பண்ணலாம் அப்படின்னு நம்ம பேச ஆரம்பிச்சதுக்கப்புறம் we went for this topic. So first வந்து எய்ம் பற்றிட்டு சார் வந்து wanted to start with a nice introduction. அந்த மாதிரி தான் பியூட்டிஃபுல்லாக ஒருத்தர் லைஃப்பை சேஞ்ச் happiness to us. அந்த மாதிரி ஆர்த்தோ நம்ம பண்றதுக்கு பேசிக்கா ஒரு சில கொஸ்டின்ஸ் வந்து கேல்குலேட் நான் கிளாரிஃபை பண்ணிக்கணும்னு நினைச்சேன். ஸோ ஐ வாண்டட் டு ஆஸ்க் தீஸ் கொஸ்டின்ஸ் டு யூ. ஃபர்ஸ்ட் வந்து சார் நாங்கள் வந்து ஆர்த்தோ ஜெனரல் டென்டிஸ்டாக ஒரு பேஷண்ட் பார்த்துருவோம். அவங்களுக்கு ஆர்த்தோ பண்ணணும்னு எப்படி தெரிஞ்சுக்கிறது, அந்த பேஷண்ட்டுக்கு ஆர்த்தோ வேணும்னு எப்படி எனக்கு தெரியும், அதை எப்படி நான் ஈஸியாக ஐடென்டிஃபை பண்ணுவேன், ஏர்லி சைன்ஸ் என்னென்ன, எதெல்லாம் பார்த்தா கண்டிப்பாக நான் ஆர்த்தோவுக்கு கண்டிப்பாக அவங்க நான் சொல்லணும். இதெல்லாம் பண்ணுறதுனால என்னென்ன பெனிஃபிட்ஸ்லாம் ஈஸியாக பண்ண முடியும், சீக்கிரமாக ஸ்டார்ட் பண்ணி அப்படின்னு எனக்கு ஃபர்ஸ்ட் ஒரு ஐடியா.
Very good question. Usually a dental dentist refer or counsel a patient only. You don't mind, I think, mixing up Tamil and English, you won't mind, no? Right.
Is there anybody who don't understand Tamil here in this crowd?
Usually a dental dentist could refer a counsel or patient only if he is well versed with what he calls as orthodontic diagnosis, which I will explain through a few slides next. And identifying and treating the oral habits like thumb sucking, the tongue thrusting, the mouth breathing in young children, and all the cross bites need early intervention. This is what the general practitioners have to identify very earlier, and they have to address this problem at a very early situation. This in turn will prevent the complex treatments and also the growth modification treatment, which is done during the growing period, is also very beneficial. By observing the child and making good clinical examination, and you could easily pick up the signs like crowding, spacing, increased verge, deep bite, the abnormal orofacial dysfunction. So how to go about with diagnosis? So always it is best to recognize the problem, you have to identify the problem, then you have to formulate, you should put in a good format, so you can classify them into good things. So carrying out the necessary examinations, interpretation of the results, and finally the diagnosis. So to come to a good diagnosis, we need three main tools. There is a case history, the clinical examination, and also the necessary investigations. So case history we all know. So how to take up a case history, like general case history, like what are good to oral medicine, we all went to the different departments. Here specifically what orthodontic need is a good extraoral examination. In extraoral what you do is you see the head shape, facial type, profile, you see the FMA, you see the nasolabial angle, lip competency, intraoral, and intraorally you should observe tongue posture, size of the tongue, shape of the tongue, intra-symmetry. See the molar relation, canine relation, overbite, individual irregularities like crowding, spacing, interarch relationship, frenal attachments, type of dentation, and in functional see for how the child breathes, whether there is any mouth breathing. Check for the swallowing, what type of swallowing has, yes, atypical swallowing or normal swallowing, and evaluate the speech. So these are the common things general practitioners have to look out and find out whether the problem is present in the child or not. Okay.
Right, sir. Thank you. It holds good. Clinical examination, investigation, diagnosis, and then treatment. With specific attention to orthodontic details. And நான் வந்து ஒரு பேஷண்ட்டுக்கு ஆர்த்தோ தேவைன்னு எனக்கு புரிஞ்சிருச்சு, நான் டயக்னோஸ் பண்ணிட்டேன். அந்த பேஷண்ட்டுக்கு வந்து ஆர்த்தோ தேவைன்னு புரிஞ்சதுக்கப்புறம் அவங்க ரொம்ப ரிலக்டண்டாக இருக்கும்போது ஹவு டு ஐ கவுன்சில் தெம், ஹவு டு ஐ டெல் தெம், வை டோன்ட் தே நீட், அதுக்கு can you please add up some points which I can use as a standard dialogue in the clinic to tell these patients, இதெல்லாம் சொன்னா பேஷண்ட் வந்து ஆர்த்தோ பண்ணிக்குவாங்க, என்னெல்லாம் பெனிஃபிட்ஸ் ஆஃப் ஆர்த்தோ, ஏன் பண்ணணும், அது
definitely. The other term I can say that why the malocclusion need to be corrected. There are multiple reasons. I found this as a very specific reason. Whenever you have a malocclusion, there is an unfavorable psychological and social sequelae that do occur in the children. A buck teeth, bunny teeth, and other nicknames in early childhood has tremendous impact on the social behavior of the child, making a child an introvert or even an antisocial element. So early correction of malocclusion boosts the child confidence level and can be a life changer also sometimes. So there is, whenever you don't do a correction of malocclusion at earlier stages, there is definitely, it will have a very great impact on the normal growth and development. You can see some facial asymmetries can be caused with a non-correction of malocclusion. You can see whenever the mandible gets locked within the mandible, we all know that there is one growth pattern is called cephalocorny gradient of growth, where the maxilla completes its growth first and the mandible later. So if at all the maxilla gets stuck within the mandible at the earlier period of time, if you don't correct the anterior cross bites or in the posterior prospect, what will happen? The mandible lag in the growth. Slowly the mandible picks up the growth at the later part of time and the mandible lags back. So this is what happens whenever you don't do a right time correction. So always there is a, whenever growth and development is happening, you have to check out time to time whether everything is happening at the right point of time. And we all know that malocclusion still can cause a lot of problems. So you won't be able to chew properly. So improper mastication and deglutition is going to be a very big problem, and it's also a very big problem for everyone. Okay, so whenever we convince a patient in a clinic, okay, பல்ல கட்டிங்க டாக்டர், பல்ல கட்டிங்க பேஷண்ட் நம்ம சொல்றோம், எனக்கு ஏன் வயசாச்சு பல்ல எதுக்கு கட்டணும்? Okay, so these points will add up to your practice also. So please note these things. Okay, so improper mastication, malocclusion, leading to improper mastication. So what happens? So what are the benefits of chewing the food? So benefits of chewing the food: always breaks down the food into smaller pieces so that you can have more enzyme action, more active surface area, and then with a better absorption. Stimulation of saliva always improves the flushing action, washes down the bacteria, and that way improving the OD health. And also we can have a very good gut health. Whenever there is a good mastication, it prepares the gut for the digestion and the absorption, and regulates the gut motility, that way preventing the constipation and diarrhea, regulates the appetite also, and also helps in controlling the weight also. So it avoids the overeating. Whenever you have a very good masticatory, giving time and do good mastication, it helps in everything. It regulates the appetite and helps in the weight control. So this is a very good carrying point. So whoever want to reduce the weight, they have to chew well and they have to have a particular good set of teeth. பல்லு ஏன் கட்டணும் அப்படின்னா என்ன இருக்கும்? நம்ம இஎம்ஐ கட்டணும், அதுக்கு கம்மி கட்டுற கதையெல்லாம் நம்ம சொல்ல முடியாது. The other benefits are chewing calms the mind and reducing stress and anxiety. This is new for me also. So chewing has been linked to the improved cognitive function, including the memory and concentration also it improves. Chewing has been shown to stimulate the immune system, reducing the inflammation and improving the overall health. Okay, so always chew the food, take more time to eat, and there should be good set of dentition for chewing. And the very important, and we are commonly we miss certain things, is speech defects. Malocclusion causes speech defects, like difficulty in pronouncing certain words which we don't pick up sometimes. So what are they? Whenever we think of speech, there are a lot of sounds which is coming out as coordination between different oral structures, like bilabial sounds, like P, B, and O. And we have labiodental sounds like F, V, and linguodental like Thai, are difficult to pronounce for the patient whenever they don't have the good jaw symmetry. Whenever there is a discrepancy in the jaw position or jaw growth, like mandibular deficiency or excessive maxillary prognathism, there is a difficulty in approximating the lips. So this will affect the children and making the speech difficult. Okay, to still thoroughly understand how the speech is generated, these pictures show that sound energy from the vocal cords has to be modified by the pharyngeal and the oral structure to have an audible sound and language. Only the sound, whenever there is a voice emerges from the vocal cord, it has to be modified, it has to be reshaped, it has to be modulated accordingly by changing the size of the oropharyngeal regions. Okay, you can see the cross-sectional change. Tongue has adaptability, tongue can fold up, tongue can expand. And all these will do the correction in pronunciation. Okay, so whenever there is a dysfunction in between, the oral dysfunction is there, definitely there will be some speech impairment. So always you can say to the patient, whenever the child is not doing the speech properly, maybe it can be a malocclusion also. Apart from neural problems, common systemic neural problems, also they should rule out it. And commonly, whenever you have you can see these two children with the such a proclination, they are very prone for accidents. Okay, during the play or even during the accidental fall, they will be losing the teeth first. Even before the nose comes to the contact with the floor, the teeth comes in. So they will be having a tremendous impact whenever they fall. Okay, so always there is a predilection to accidents. So that also you can say. The commonness will increase caries incidence. Whenever you don't have a good dentition, what will happen? There will be a lot of food impactions. And main one is trauma from the occlusion. As I said, masticatory forces has to be carried out and dissipated throughout the jaw. So we have to have a very good set of teeth where it can transmit all the forces of mastication into zero. And poor plaque control and TMJ dysfunction, everything will follow whenever we don't have good setup.
Thanks for the points. முக்கியமா நல்லா சாப்பிடுறதுக்கு ஈஸியா க்ளீன் பண்ணிக்கிறதுக்கு சொந்த பல் வராமல் இருக்கிறதுக்கு பல்லு கீழே விழுந்தா ஈஸியா உடஞ்சிடாம இருக்கிறதுக்கு இது நல்ல உச்சரிப்பு வர்றதுக்கு இது எல்லாத்துக்கும் வந்துட்டு இஃப் யூ ஆர் இதெல்லாம் உங்களுக்கு வேணும்னா நீங்க ஆர்த்தோ பண்ணிக்கோங்க அப்படின்னு சொல்றதுக்கு வந்துட்டு வேலிட் பாயிண்ட் சார். ஆனால் அந்த மாஸ்டிகேஷனுக்கு மட்டும் இவ்வளோ இம்பார்ட்டன்ஸ் கொடுத்து ஸ்ட்ரெஸ்ஸை குறைக்குங்கிற வரைக்கும் எனக்கு நிற்கிறது. சாப்பிட்ற ஒழுங்கா ப்ராப்பராக சாப்பிட்டோம்னா கண்ட்ரோல் ஸ்ட்ரெஸ்ஸுங்கிற வரைக்கும் ஒரு வேலிட் பாயிண்ட் நமக்கு கிடைச்சிருக்கு. வி கேன் இம்ப்ளிமெண்ட் திஸ். இப்போ பேஷண்ட் வந்துட்டு சொல்லிட்டாங்க சார், நீங்க போன வாரம் வந்துட்டு போயிட்டீங்க, அடுத்த மாதம் தான் வருவீங்க. எனக்கு ஒரு மாதத்துக்கு ஒரு தடவை தான் நீங்கள் வரும்போது ஒரு ஆர்த்தனாடிஷன் வர்றாரு, அவருக்கு ஒரு மாதத்துக்கு ஒரு தடவை வரதா இருக்கும். எப்படி சார் நான் ஹோல்ட் பண்ணுறது, என்னெல்லாம் நான் பண்ணணும்? அந்த பேஷண்ட் வந்துட்டு எனக்கு கேட்குறாங்க, டீத் அலைன்மெண்ட் பண்ணுறதுக்கு முன்னாடி நான் என்ன நான் உங்கள்கிட்ட சொல்லி வைக்கணும், ஏதாவது ஸ்டார்ட் பண்ணலாமா, ஏதாவது பண்ணி வச்சு அந்த பேஷண்ட் ஹோல்ட் பண்ணலாமா, எப்படி அவருக்கு எஃபெக்டிவாக கொடுக்கணும். பட் ஆனால் இமீடியட்டாக ஏதாவது ஆர்த்தோ பண்ண முடியலன்னா நான் என்ன பண்ணணும்?
In this modern era, we have plenty of communication thing. Okay, you can come to a video call and you can have a talk with even the clinician directly. The orthodontist can have an interaction with even the patient also. So one thing we can do is prepare the physical records like models, radiographs and photographs. Even before the orthodontist attends the case, you can prepare the physical records, all these things. And prepare mainly whenever an orthodontic treatment is planned for a patient particularly, all the restoration of caries, all the plaque control, and all the active gingival and periodontal infections if any has to be controlled. So without control of this, you can't start an orthodontic treatment. So the primary dental dentist, whoever is going to see the patient first, is to prepare the patient for the orthodontic treatment. So preparation is so important. And the orthodontic job is made easy whenever the dental dentist explains the treatment options also to the patient. After careful diagnosis, you have to explain all the treatment options to the patient. You open every option to the patient, tell the pros and cons of the treatment methodologies, and you can get the approval from the patient even before the orthodontist, so that orthodontist work becomes simpler and easier. Whenever he comes, he can start it, jump into the work and he can do the work.
Extraction within the time of retail destination.
That you can say as extraction may be needed after careful analysis, after some investigations has to be done. For example, supplementary evaluation is very important. What you are going to do is you are going to take the supplementary, you are sent to the orthodontist, and he is going to analyze it and finally tell whether the child has to go. You come and clear treatment, how you go up to the case. Whenever you prepare a case, how to go up with the case. And as such, there is no temporary solutions as such. Okay, so all this has to go by methodology. The legal work you have to do earlier, so the orthodontist work becomes more simple and easier and less complication occurs. Okay, so there is no time delay in that.
சில டைம் வந்துட்டு முதலே சொன்ன மாதிரி 12 வயசுக்கு அப்புறம் வாங்க அப்படின்னு நிறைய ஜெனரல் டென்டிஸ்ட் அனுப்பிச்சிடறாங்க. பேஷண்ட் வந்துட்டு கரெக்டாக பிக் பண்ண மாட்டாங்க, லேட் ஆகிடும். அப்போ பார்க்கும்போது ஐயோ நம்ம முன்னாடியே பார்த்துக்கணும் அப்படின்னு ஆர்த்தோடான்டிஸ்ட் சொல்கிறாங்க. எதுதான் பெஸ்ட் டைம் சார், எப்போ நான் பண்ணணும்? இப்போ வந்துட்டு ப்ரிவென்டிவ் ஆர்த்தோடான்டிக்ஸ் பற்றியும் இன்டர்செப்டிவ் ஆர்த்தோடான்டிக்ஸ் பற்றியும் உங்களோட தாட் ப்ராசஸ் சொல்லுங்கள் சார். ஏன் வளர்ந்த ஸ்பீக்கர் ஆல்சோ கோயிங் டு டாக் அபௌட் ஆல் அப்டேட்ஸ். ரொம்ப பார்த்து நீங்கள் இதுக்கு என்ன பண்ணுறீங்கன்றதை
Murugesh sir is going to talk extensively about all the removable orthodontic appliances which can be used day-to-day practice. Okay, I just going to have just a glimpse of all those appliances as I will ask for it. In other words, an orthodontic treatment should be ideal or favorable. This can be explained. I will explain to a few slides. And preventive and interceptive procedures are not age-specific. First, you should understand that they are not age-specific. Preventive and interceptive procedures, they are not age-specific. They are problem-specific. Okay, whenever the patient comes, don't expect to do a preventive or interceptive procedure just because he has crossed certain age. Okay, problem dictates the clinician to do the needed things. Okay, so always it is better to recommend and minimize the corrective procedures and reduce the complexity. So always go for interceptive procedures and preventive procedures. So when we have to go for it. And most orthodontic patients, usually they come at very early age and during the adolescent period. Nowadays, adult group patients also seek a lot of orthodontic treatment. The first thing what you have to do is determine the biological or skeletal age. So we have to know that there is a chronologic age. Chronologic age is regular birthday, what year they are born in. This is not going to match the skeletal or the biological age. What we do is you examine the patient, you examine the hand disc X-rays, even the cervical vertebrae gives an idea. You can have, you don't need to go for hand disc sometimes. From cervical vertebrae also you can evaluate the skeletal age of the patient. This shows how much of growth is left in the patient. Okay, this gives a clue to introduce functional appliances like growth modifying appliances. You can go for orthopedic appliances where you can have a complete response from the growth side. Okay, whenever the patient is not completed growth, it is always best to have a evaluation earlier, identify the skeletal age and do accordingly. As I said, the growing period, you can even do mild and moderate corrections and the results are quite stable. You understand the word, the results are quite stable. Why? Because there is, whenever there is a movement from one position to another, there is a reorganization of tissues and there is a developing engram of the muscles to give stable results. We all know that muscles, whenever it is developing, it has to have a final length and final activity. So this engram is set only when the form and function effect. Okay. So correction of whenever you do some correction in the form, in the function, it has to have a morphological impact also. So form and function are correlated with each other. This you can understand whenever you study the growth in detail. So correction of mandibular prognathism, there is one caution. Whenever you do some correction of mandibular prognathism with orthodontic surgery, it is generally deferred until the mandibular growth completes its complete growth. Okay, probably 18 in males and even earlier in females. Okay, so you have to wait until the mandible completes its entire growth so that you can have the, otherwise you have to do a two-step surgery. So you have to do another surgery also whenever the growth is getting completed in later stages. So always be cautious in treating a mandibular prognathism case, while other cases can be treated very earlier, in mild to moderate cases, doing at a growing age is going to have a very good impact. The results will be very much stable. And of course you have the functional appliances, a lot of functional appliances. You can have a twin lock, you can have a reverse face mask, you can have a headgear to control the excessive maxillary growth. And the very important function is here is going to be your, these functional appliances are going to have a very good impact. It is going to train the muscles, it is going to have a very good functional dysfunctions or eliminated completely these appliances. And right thing to do is in the early age, growing age. So apart from these functional appliances, the general practitioners can go for habit breaking appliances, expansion appliances, wide opening appliances, anterior crossbreak correcting appliances, and lot of preventive and interceptive procedures can be done during this mixed dentition period or the period where you can have a maximum response from the patient side to the growth. So correction of proximal caries, using the space maintenance, extraction of supernumerary, correction of tongue tie, abnormal labial freedom, upper clipping of unnatural, all these could be done. And these are some of the habit breaking appliances. If at all you are, which is the bluegrass appliance, which is very commonly used for thumb sucking cases. So they don't have the feel of negative pressure whenever you have something in between the teeth and the palate. Okay, so this is a bluegrass appliance. All entire appliances are very nicely fabricated and given by Murugan's lab, orthodont lab is there. I usually give to them, they just give the model, they finish everything and give you a perfect fix so that you have very less time to spend there. So always you should have a very good lab support to do these appliances. And this is a lip bumper, you would have seen it. This is a fixed one and you can have a removable lip bumper also. Lip bumper has multiple things for lip sucking. And you can even displace the molars also. Sometimes you may need some space in the lower anterior region for aligning the lower anterior teeth. You need some molars may be easily angulated. So whenever you see the OPD, you can see some easier angulation of the molars. You can upgrade this and you can even correct with the help of the lip bumpers. So many appliances can be used in a variety of ways. Here is a classical expanding appliances. Okay, simple semi screws are there. So simple anterior bite correction. If there is a group of teeth you can use a simple maxillary expander, and there is a high rise or rapid maxillary expander where you can have some posterior expansion also. You can expand the posterior segments also with the help of the rapid maxillary expander. And very important is the bite opening ablation. Many of the time we will be missing the deep bite condition. Okay, so always whenever you see a patient with more deep bite is going to cause tremendous impact on the lower dentition as well as the upper dentition, anterior dentition, because whatever force is going to be generated again by the mastocytoma has to be borne by the anterior teeth, which is not designed to take up such loads. So always whenever you have an anterior deep bite, you have to correct it. You can easily simply correct with the anterior bite plane. And in growing ages, whenever you separate the jaw, separate the posterior teeth, it will be supra-erect and will get accommodated very well. But in adults, if you do this, again there will be a little lapse. Okay, there is another method. We can do some anterior inclusion, everything. For growing children, bite opening is very much can be done with the removable upper anterior bite plane. Then you can have a simple, very good Catalan's appliance. For single tooth cross bite, you can just fix this appliance in the anterior teeth. So there is a plane effect. So the tooth which is locked inside just moves out easily and comes to a regular position. And as I said, there is a lot of interceptive preventive procedures, as I said. And there is whenever these procedures has to be done in a mixed dentition period, there is a transition from deciduous to permanent dentition.
Okay, sir. First, the patient on the age, the problem correct on the demand. Not all the growth problems can be corrected by it. Mandibular comprehension, I wait. Mathematics, whichever can be corrected, I will do. First, I go with the age estimation, other growth estimation, skeletal growth assessment. Skeletal growth assessment. I see how much is the growth completed. Accordingly, I plan the appliance and give the patient. Yes. Okay, sir. The serial extraction is very important. Serial extraction is something what they wrote, right? The complexity is very funny. Easy to
the parent understand.
Problem வந்து severity குறைக்கிறதுக்காக நான் இத பண்றேன். அப்புறம் நம்ம வந்து அத மேனேஜ் பண்றது ஈஸியா இருக்குங்கிறதுக்காக இந்த preventive measures எடுக்கிறேன்னு சொல்லி நம்ம எக்ஸ்பிளைன் பண்ணிட்டு இருக்கோம். சரி சார், இப்போ பார்த்தாச்சு. இப்போ வேற என்ன ரெக்கார்ட்ஸ்லாம் இருக்கு சார்? whenever I want a patient to be ready for ortho, what are the basic records that you estimate as to keep ready and give you when you come for treatment?
As I already told you, it's just a repetition only. So you have to prepare all the case history and pertaining records, like models. You need a good models of the patient. Nowadays you can have, if you have a scanner also, you can take a digital models and keep it like this. And models always helps the patient to see the follow-up. Whenever the patient asks after 6 months, how I look back. Okay, they won't be remembering all these things, but you have to bring back memories to them and you have to show the model and make them to realize that so much of changes have happened. Okay, then only they feel value for money. Okay, otherwise they will be asking questions. So always have a record with you. So whenever you start an orthodontic, you have a model, a very good model, so that you can repeatedly show to the patients. And you can take in stages also. You can take different models and keep with you. And you can have good radiographs. So always take a OPG radiograph even before the treatment. Why? Because whenever the patient presents with some other pathological lesions or any periapical problems or any root resorption, so you should not be in a trouble after doing orthodontic treatment. So always have a pre-treatment radiographs, specifically OPG and the lateral spectrograms, and definitely you should have all the photographs of the patient before treatment, intraoral as well as the extraoral. So these are the common things you have to keep, not only for the purpose of treatment but also for the legal perspective also. So you should have all these as a record with you before starting your orthodontic treatment.
Definitely, medical legal point of view, I want to add. Actually, a growing patient நம்ம clinic வந்தாங்கன்னா அவங்களோட growth முடிகிற வரைக்கும் we are supposed to maintain all the records. ஒரு வீடியோ பேஷண்ட் நம்ம 3 வயசுல நம்ம பார்க்குறோம்னா அந்த பேஷண்ட் நம்ம ட்ரீட்மெண்ட் பண்ணணும்னா until they become 80 we are supposed to maintain medical records. அதுதான் our code ethics says. மற்ற எல்லாருக்கும் only 2 years of record maintenance is enough. கோர்ட்ல வந்து ஒரு 1 year கன்வென்ஷன் டைம் கொடுத்து 3 years வரைக்கும் உங்கள்கிட்ட டேட்டா கேட்கலாம். அதுக்கு மேல 3 இயர்ஸ்க்கு மேல நம்ம பேஷண்டோட பழைய டேட்டா இல்லைன்னு பரவாயில்ல. ஆனா the ortho patients-உம் video patients-உம் we start early. It is important for us to maintain long time record. நான் ரீசெண்டா ஒரு பெரிய கிளினிக் போயிருந்தேன். அங்க வந்து ஒரு பெரிய ரூமே வச்சிருந்தாங்க. ஆர்த்தோ ட்ரீட்மெண்ட்